3 News has been looking into how Cleveland's first responders are preparing to help potential patients. Mark Namick obtained records that offer a glimpse of how the city plans to react and keep workers safe.
Cleveland's emergency workers handled more than 100,000 calls for help last year. With confirmed cases of coronavirus slowly creeping across the country,
by urging all Ohioans to listen to the public health and medical experts.
Cleveland and other cities are preparing their workers for how to respond to the possibility that the virus hits home. Records obtained by 3 News detail what city workers are supposed to do if 911 dispatchers receive calls from people complaining of breathing problems or flu-like symptoms. Dispatchers will first screen callers about their contact with people who recently traveled or who are being tested for the coronavirus. The city will then follow rules for treating people with potentially infectious respiratory diseases. This requires EMS workers to wear protective gear and respirators and send a second, specially equipped ambulance to the scene. It has a sealed cab to keep EMS drivers from coming in contact with the patient and crew, according to city documents. In suspected cases of coronavirus, the city will keep patients in the ambulance until ER hospital workers can dress in protective gear. EMS workers and firefighters who didn't want to speak on camera told 3 News they have questions about the protocol and concerns about the possibilities of quarantines for first responders and even their families. Such issues, they say, have not been clearly addressed. City Hall did not respond to questions about its EMS orders or plans for managing the possible spread of the virus.
Cleveland, like most cities, has plans on the books for dealing with infectious diseases, and officials insist that they are updating those plans for the coronavirus. As for first responders, a few tell me they would like to hear more details. Russ?
Okay, Mark Namick in the newsroom. Thank you.